Good morning. I'd like to provide an update on the continuing status of Metro's efforts to address COVID-19, the novel coronavirus. As stated previously, on January the 29th, Metro activated its pandemic task force in response to the reports of novel coronavirus, subsequently named COVID-19. The Pandemic Task Force is an interdisciplinary team comprised of key stakeholders from safety operations, occupational health and wellness, emergency management, Metro Transit Police Department, procurement, media and employee relations, and customer service. At that time, the task force initiated planning in accordance with phase 1 of the plan. The Metro pandemic plan has 4 phases. During phase 1, the Pandemic Task Force assesses the current stock level of critical supplies and increases those stock levels by 25%, issues messages with regard to effective employee habits to prevent outbreak, coordinates with local, regional, and federal authorities, and we begin tracking absenteeism and ridership to serve as a baseline and initiate the planning process for various contingencies. We increased cleaning and disinfection during our phase 1. In March, we have progressed to phase 2 of 4 in our pandemic task force. Phase 2 of 4 in implementing the plan includes daily cleaning and disinfection practices, enhanced communications, continued coordination with local, state, and federal authorities, and the initiation of exercises and drills to confirm preparedness procedures are adequate to meet a number of potential outcomes. We are accelerating the planning process for all potential scenarios and continuing strategic sourcing of resources. We've deployed the resources out to the field, they're prepared for distribution, and we're continuing all phase 1 activities. Should Metro move to phase 3 of the plan, we would continue all of the phase 2 activities, open the Emergency Operations Center, implement the plans for scenarios, modify service as needed, and support the regional response to the COVID-19 outbreak. The last phase of the Metro pandemic plan is phase 4, which is recovery, focused on restoration of services and critical self-assessment and lessons learned to inform future planning efforts. The task force has met weekly since its activation. Phase 2 was activated when there were confirmed cases in the region. During phase 1, we focused on preparedness. Now we're moving forward to assure readiness. We've released notices to our customers via our website and have collaborated with media efforts to emphasize our efforts to engage with the public to assist in preventing transmission. We will be increasing the types and frequency of internal and external communication and will continue to implement the commensurate elements with regard to stockpiling of critical items and continued expanded use of disinfectants and monitoring of absenteeism rates. I'd like to detail some of our cleaning protocols. We are currently cleaning and disinfecting frequently touched surfaces in our stations. This includes our fare machines, fare gates, and handrails on a daily basis. We are cleaning and disinfecting our vehicles. This is buses, trains, and Metro Access vans with the use of hand wipes that apply an EPA-approved disinfectant on a daily basis. We've begun use of electrostatic fogging equipment in an expanded capacity on our bus and rail cars on a weekly basis. We are currently following CDC recommending cleaning and disinfection practices and using EPA-registered disinfectants. However, we've been emphasizing the most effective way to prevent the spread of disease in our system are the preventive actions that are taken by our customers. While our routine cleaning and disinfection practices will play a role in minimizing the spread of COVID-19, hand transfer of the virus to mucous membranes of the eyes, nose, and mouth may result in infection. This can be interrupted by the use of proper hand hygiene and cough etiquette. Proper hand hygiene and respiratory hygiene are the principal means of interrupting this type of transmission. We are also maintaining spot disinfection capabilities for all locations and equipment should we have an outwardly symptomatic individual reported on the system. With regard to our communications, the task force has issued numerous messages. Our general manager has issued messages to employees along with email updates reiterating the CDC guidance. We've also communicated with our team that they have resources available through the Employee Assistance Program to help them navigate this difficult time. We've recorded podcasts with our medical expert to answer questions that employees are commonly asking. We've employed a multi-channel communication effort through written bulletins, email messages, postings at work sites, as well as intranet updates, podcasts, and we've partnered with our labor organization leaders to have an external live webcast in which we answered questions from the workforce. With regard to our customer communications, our messaging has served to echo and reiterate the CDC guidance. We have a homepage of our website that's been uploaded. We've also proactively sent emails to our Smart Trip and Smart Benefit customers. We've placed CDC messaging on our digital networks system-wide, and we are currently exploring additional networks to reach a wider audience, including the Board of Trade, Destination DC, and the Consortium of Universities. Additionally, we have encouraged our customers that if they are ill, they should call ahead to their medical service provider and make alternative arrangements to travel for treatment instead of using public transportation. In addition to our internal coordination and preparedness efforts, we've been working closely with local, state, and federal agencies to keep abreast of the latest efforts to combat the disease spread and to assure the health and safety of the region. We've participated in multiple planning activities with CDC, as well as DHS, TSA, FEMA, and the U.S. Department of Transportation. At this point, we are following the latest CDC guidance. With regard to our next steps, we are currently preparing for phase 3 of our pandemic plan. That includes identification and prioritization of critical functions within operations and maintenance, reviewing all of our internal procedures to identify any crucial gaps. We've reviewed our HR policies, we're exercising our IT capabilities, and we're still coordinating through supply chain disruptions to ensure that we maintain an adequate level of supplies to respond to the incidents. We are evaluating potential options for reduced or alternate service. We are ramping up our communications and preparing response scenarios for potential phase 3 with regard to service and staffing expectations to provide continuity of operations. We've continued monitoring absenteeism and will consider alterations to service in the event of increased employee absences or illnesses. Thank you, Mr. Chairman.
Thank you, Ms. Impastato.